And a proposed medical tower at Tan Tock Seng Hospital will add around 600 acute hospital beds. This is on top of the over 2,000 beds the hospital has currently. The new tower will also have an expanded emergency department that can provide faster access to patient care. The project is expected to be completed after 2030, and the move comes amid expected growing demand for hospital services as Singapore's ageing population increases. Sabrina Ng reports.
This is what the next phase of the Health City Novena master plan, an integrated hub in central Singapore, could look like. But before its completion, Health Minister Ong Ye Kung says the new campus must be able to support emerging needs and deal with future pandemics.
The TTSH campus has since gone through many rounds of upgrading, of refurbishment. However, as the Singapore population grow older and the healthcare needs of our population become more complex, we need more than just a refresh of aging facilities, but a major revamp and reimagining of the value and offerings of the entire campus.
The buildings labelled in black are existing facilities before the master plan was launched over a decade ago. The buildings labelled in blue were completed during Phase 1, which ended last year. Next up for Phase 2 are planned developments in orange. And space for future developments, labelled in green, are for areas like medical education or training. All these aim to bolster rising demand for Tan Tock Seng Hospital's services. Between 2020 and last year, admissions and outpatient visits at TTSH increased by an average of 5% each year. Tan Tock Seng Hospital says it manages over 125,000 emergency department cases each year. Last year, around 40% of those patients were aged 65 years old and above. That's compared to some 30% around 5 years ago. As such, the hospital is studying the relocation of its emergency department to the proposed medical tower to cope with rising attendance. The hospital adds that it will review workflows at its new emergency department. This is to allow faster triage and minimize unneeded patient transfers. It will also tap technology to trim manpower needs.
We cannot just try to hire more and more people because there's always a shortage of manpower staff across the entire healthcare sector. So what we are trying to do here is to introduce new care models that will help us to do things perhaps in a better way, that will reduce the reliance on manpower. We also want to redesign some of the roles and see where perhaps automation or technology can come in. Today, we are already trying a lot of that technology in our smart ward in our hospital.
The second phase of the Health City Novena master plan is expected to be completed after 2030.
And for more on this, Chief Executive Officer at Tan Tock Seng Hospital, Adjunct Prof. Dr. Tan Kong Chung joins me now. And with him is Adjunct ASOC Prof. Dr. Bernard Tong, who is Chairman of the Medical Board at Tan Tock Seng Hospital. Gentlemen, thanks for joining us in the studio today. Dr. Tang, I want to start with you. Now, besides coping with a bigger patient load and also a faster handling of emergency services, how will the proposed medical tower change healthcare for Singapore?
I think we all know that the healthcare demand is going up rapidly with our aging population. So we can't just do more of the same. We are thinking about how we can introduce new care models, such as having what we call a frailty-ready campus. This ensures that we will then be really targeting our care at frail elderly population and making sure that when they come for care, it is something that will be smooth and it will be something convenient and connected for the patients and their family members.
Now, frailty ready sounds like there's a lot of focus now on serving our seniors better. So maybe Dr. Tong, if you could tell us what exactly does this entail, not just for the patients, but also for the families that have to engage in this care as well?
Yes, so in fact, I think it does involve a lot of attention, not just for the patients themselves, but the family members do also need to be engaged in the care of these patients. So increasingly, as we know, within our healthcare cluster, we do see a fairly elderly population. In fact, probably more than 60% of our population within the national healthcare group tend to be individuals above 60 years of age. So in a frailty-ready hospital, not only the medical staff, but also the nurses, the allied health professionals, and all other individuals who are involved in the care of the patient do need to look at it from a holistic point of view, not just from the medical angle, but perhaps even from their nutrition, their psychological well-being, from the time when they enter the hospital to the time they leave the hospital. So we need to make sure that the care is integrated along all the service lines so that the patients can safely return home.
And speaking of integration across service lines, another highlight here is the expanded emergency department.
Yes.
So how will that tangibly change the experience for patients that go to Tan Tock Seng?
So I think our emergency department is now 26 years old since the day we opened shop in 1999. So in terms of the infrastructure, the capacity, it is slightly limited. In our emergency department, other than the acute strokes that we see, because we are the National Stroke Referral Centre, we are also the central trauma region, where many of the more severe trauma patients do end up with us. Some of these patients are fairly elderly, and we find that in managing these elderly patients, we do need to make sure that the infrastructure and the supports are there. We also need to ensure that there are enough facilities for the family members to be involved in the care as well. So in the new centre, in the new emergency department, there will be more rapid access, for example, to the operating theatres, to the angiography suites, for procedures to be done in a very expedient and a rapid manner, and to turn around the throughput of the patients moving through the A&E.
And a new tower sounds like, it helps to accentuate the speed element with a lot of use of smart solutions as well. So Dr. Tang, I want to get to you. What smart hospital features will be of particular interest to any of our viewers who are patients or who are caring for patients as family members?
I think a smart hospital is not just about bringing in new technology. That technology has to improve the care that we are providing and also help the staff in the provision of the care. So in a smart ward that we have today, actually we want to activate our patients to take ownership of their health, so they get information about their treatment protocol, when they can go for certain exercises or programs like rehab, and that allows them to then be participative in their own health, and we hope that that will also carry on when they go home. We are also tapping on a lot of things like robotics. You have seen in the video earlier on, because this is important as the healthcare workforce is also aging. We need to take care of our workers, make sure that the menial aspects of the work can be taken over by machines. But we are very, very careful about also ensuring that we still maintain that human touch in healthcare.
Yeah. So I think being digitally enabled is important, not just from the patient's point of view, but also from the family members. And ensuring that they are digitally enabled does also mean that our healthcare workers of tomorrow do have to learn some of these digital enablements. For example, the use of AI, the use of bioinformatics, predictive analysis. The idea is to improve the system so that the system is a little bit more efficient, and we are then able to create more capacity for patients who need expedient help.
And with improvements to the system, how do you think this will then impact the idea of medical tourism to Singapore? Dr. Tang.
Well, I think we are firstly here to serve the residents and the patients in Singapore. And if there are patients who would like to come to Singapore to seek help, I think that's something that we do take care of when the situation arises.
Yeah, Dr. Tong, any views on that as well? Whether, with Singapore sort of spearheading these technologies or these developments, that there might be a chance for people not only to come here to have their medical treatment, but also it might be kind of a beacon for a lot of other countries as well to explore potential developments that Singapore is currently exploring.
Yes. So in fact, we have a lot of trainees, specialty trainees, not just the doctors, but also the nurses as well as the allied health staff from the region who do come to Singapore to learn. Because I think we have got a pretty good healthcare infrastructure. We've got a very nice healthcare financing system, which is probably a little bit different from the rest of the world. So we do have a lot of people who ask to come to perhaps observe how we do things, to come for study visits, and in fact sometimes they even come for several weeks or months to learn a little bit more about the healthcare system, learn about our clinical practice, and they bring some of these good learnings back home to develop in their own regions and their own country.
Yeah, and speaking about these learnings, right, training would be a very important element, Dr. Tang. As you mentioned earlier about the technologies and the smart solutions that are going to be implemented, how will the staff then be trained adequately, given that these are very new developments in technologies as well?
So we have a Center for Healthcare Innovation in NHG Health, and this is the center that helps to bring the innovation and scale it up across the cluster, and this helps to really bring technology to all the different institutions, not just limited to one hospital. At the same time, we are also rolling out programs to ensure greater literacy in terms of digital and AI among our staff. For example, we now have an AI 101 program for all the staff that they can then learn about this and see how they can really harness the potential from the emerging technologies.
Well, I like how you say that, healthcare here really isn't just about the hospital. It's really a bigger network of different institutions, doctors, GPs, even healthcare staff here, community partners even. So how will patients be able to move more seamlessly across the system given the developments expected in the new medical tower?
So in fact, we work very closely with our community partners within NHG Health. We have a population health campus which looks after the community as well as some of the step-down care facilities. And we have both the polyclinics as well as some of the healthier SGGPs, primary care networks, who are all closely involved in the system. So one of our recent projects, for example, the Integrated Care Hub, is a tertiary as well as a secondary rehab facility, which also integrates very closely with Dover Park Hospice, which is a voluntary welfare organization, which looks after patients at the end of life. So what we've done in this entire ecosystem is to start, in fact, integrating and working very closely with our community partners. So we have doctors, nurses, allied health professionals working with the community partners and within the community as well. And so we hope that by doing so, we not only bring some of the learnings and the new technology that we've established within the hospital, but we also learn from the community, because what's needed out there is really very different from an acute hospital. So there's co-learning and co-development of many of our projects on the campus.
And with all these developments and investment in new technology as well, I guess a big question for a lot of viewers, Dr. Tang, is how it will affect cost when it comes to patient care. So will that have an impact on patients going to Tan Tock Seng?
I think for our hospital, we have always been very patient-centric, and partly also because of the legacy from Mr. Tan Tock Seng, who started the hospital many years ago as a philanthropic effort. And on top of all the government subsidies and the areas that patients can tap on, we also have a community fund that ensures that no needy patients are left out of care and that we can support them every step of the way.
Dr. Tang, Dr. Thong, thank you so much for coming in today. Really appreciate your insights and sharing all these developments with us. Our guests tonight are from Tan Tock Seng Hospital Chief Executive Officer, Adjunct Prof. Dr. Tang Kong Chung, and Chairman of the Medical Board, Adjunct ASOC Prof. Dr. Bernard Tong.